Okay.
Okay?
Yeah.
All
You
right.
can start. I'll edit.
Okay. So, in the Enrich trial, among the things we wanted to do was see if treating low perceived social support would improve cardiac outcomes among patients after acute myocardial infarction. And the rationale for doing so was a series of studies that had shown low social support to be associated with poor outcomes in a population of that kind. Um, in the design of the study, we were dealing with a situation where there wasn't much precedent, and that was treating low social support. In addition to that, among the issues was the fact that social support is a multifactorial variable, and it's comprised of several components that include tangible support, instrumental support, emotional support, and even within the context of those, the perception of having support. So it could be that objectively we look at an individual and we say, well, gee whiz, this person sure seems to have a lot of people in their network and people who are there to help them with things and people who are there in saying that they are loved, yet the person's perception is that they are unsupported. And so we were having to choose what we felt was the most important aspect of support to focus on. What we chose was the emotional support, or the perception of emotional support, and this was based on some of our reading of the literature up to that point. The next question was, how do you intervene? How do you essentially treat a condition of that kind? And again, we were dealing in a situation where there had not been very much precedent, so we were having to create an intervention that we thought would produce the outcomes that we were hoping to achieve. We took a multifaceted approach in doing so, and this included, number one, working with the randomized participant to do things like outreach, to begin to essentially social support type of behavioral activation, where we would work with the participant, encouraging them to engage in socially based activities, to engage in activities in their community, whether they would be related to church, whether they would be related to leisure activities, things in the arts, going to museums, going to libraries, engaging in conversation with people who live next door, for example. We also work with them more on directly on skills. So we had a protocol that followed standard social skills training, things like communication and conversation, things like assertiveness. Part of our focus on assertiveness concerned an understanding that in many cases the social network can actually be burdensome. And so here is the individual who has just suffered a myocardial infarction. They are a key person in their network and engaged in helping others around them. And even in the case, for example, of the immediate family person, as is often the case, a wife returning home from hospital is expected to pick up with the homemaking responsibilities that she was taking on prior to the cardiac event. And so part of what we saw there was a way to use assertiveness, communication skills training, so that the patient could communicate with those around them to try to get their needs met. And we were now implementing this in a psychotherapy type context. The thing is that while a person might not be happy with the type of support they have, while they might not perceive themselves as having the degree